When caring for your most fragile patients, every drop of blood counts. The BD Microtainer family of products keeps the focus on your patient by helping to streamline the sample acquisition process. Whether collecting for hematology and lead screening requests from neonates, pediatrics, critical care, oncology, or geriatric patients, the instrument-compatible BD Microtainer MAP, microtube for automated process, combined with BD's Quick Heal Lancet and contact-activated Lancet, helps you provide gentle care while assuring high-quality, accurately identified samples, delivering the utmost in patient safety. Microtubes typically require manual workaround processes that waste time and manpower. The BD Microtainer MAP microtube for automated process is compatible with most hematology laboratory instruments and can be run automatically. The MAP's full compatibility with lab instruments eliminates up to 10 steps from current microcollection procedures, reducing turnaround time and overall costs. The 13 by 75 millimeter MAP tube with its pierceable cap fits standard instrument tube racks. And the familiar size and feel of the tube and cap make the MAP tube easier to handle while collecting and labeling the sample. The one-piece MAP tube doesn't require the assembly of a separate add-on extender or collector. This feature enhances healthcare worker safety because there are no extra contaminated parts to remove and dispose of separately. The large collector prevents blood from dripping down the outside of the tube. The label on the MAP tube is specially designed with a transparent top portion, which allows full visibility of both the sample and 3 fill lines to maximize accuracy. The label also reminds users that 8 inversions are required to mix the EDTA additive with the sample, helping to assure a quality sample. A color-coded notch on the top of the label and a matching color stripe on the side and bottom of the label display the tube cap color, allowing for proper additive identification even after the cap is removed. And the label's notch and stripe allow the clinician to properly align the patient identification label to the MAP tube. Conventional microtubes can be difficult to label, often causing further complications when the sample reaches the accessioning team. Relabeling of microtubes can be time-consuming and can lead to potentially dangerous patient identification errors. Because the BD Microtainer MAP accommodates a full-size label, the need for relabeling is eliminated, minimizing the potential for specimen identification errors and avoiding relabeling costs. The MAP tube's cap utilizes a twist assist feature for easy removal, and an audible snap ensures proper closure and a leak-proof seal. The innovative cap design also reduces the dead volume of blood left in the tube when processing in automated mode. The MAP tube can be processed in automated mode with only 375 microliters of blood, a vital consideration for patients with low blood volumes or where venous access is difficult. The BD Microtainer MAP microtube for automated process with K2 EDTA is packaged 50 to a shelf package and 200 to a case. The shelf package, with its recyclable tray, includes pictorial user instructions. Using the BD Microtainer MAP microtube for automated process for sample collection is simple and straightforward and requires no changes from your usual microcollection technique. Let's look first at the steps involved in performing a heel stick collection. First, assemble the supplies you'll need to perform the heel puncture. Personal protection, such as gloves and a lab coat. MAP tubes. Alcohol swabs. Clean gauze pads. An appropriate warming device, and the appropriate BD Microtainer Quick Heal Lancet. You'll also need the lab order or test requisition, along with any pre-printed labels which may have been provided. After verifying the patient's identity, identify the appropriate collection site on the infant's heel. Choose a site only on the most medial or lateral portion of the heel, never on the posterior curvature of the heel, nor on the arch of the foot. It's important to avoid areas where bone, tendon, muscle, or scar tissue may be contacted below the skin. And of course, never attempt a new collection over a previous collection site due to the risk of infection. To help increase blood flow to the site, the infant's foot should be warmed using a warming device or moist towel heated to not more than 42 degrees centigrade. Next, cleanse the collection site using the technique specified by your institution. Remember to allow alcohol solutions to air dry thoroughly, both to provide complete disinfection and because any remaining alcohol adds to the risk of hemolysis in the specimen. To perform the collection, hold the heel with a moderately firm grip and position the base of the quick heel lancet firmly against the most medial or lateral portion of the heel. Using your index finger, depress the trigger firmly and completely. The trigger will remain depressed after activation. Before collecting a specimen, be sure to wipe away the first drop of blood with a clean gauze pad. Position the BD Microtainer MAP tube directly beneath the puncture site and let blood drip into the tube. Applying and relaxing pressure with the thumb intermittently helps to ensure continuous blood flow, allowing the capillaries to periodically refill with blood. Applying pressure at the ends of the quick heel lancet incision will open the site slightly, also helping to maximize blood flow. Wipe the site frequently with a clean gauze pad during collection to remove residual blood. When the collection is complete, apply pressure to the collection site until bleeding stops. Cap the tube and mix the EDTA additive with the sample by gently inverting the MAP tube 8 times. Finally, label the tube with a full-size label that includes all necessary information for proper patient identification. Using the BD Microtainer MAP, microtube for automated process for finger stick collection is simple and straightforward and requires no changes from your usual micro collection technique. Let's look at the steps involved in performing a collection. First, assemble the supplies you'll need to perform the collection. Personal protection, such as gloves and a lab coat. MAP tubes. Alcohol swabs. Clean gauze pads. An appropriate warming device. And the appropriate BD Microtainer contact-activated lancet. You'll also need the lab order or test requisition, along with any pre-printed labels which may have been provided. After verifying the patient's identity, locate an appropriate collection site. Either the middle or ring finger is preferable. The 5th finger must not be punctured because the tissue depth is insufficient to prevent bone injury. To help increase blood flow, the patient's finger should be warmed using a warmer or moist towel heated to not more than 42 degrees centigrade for 3 to 5 minutes, or by rubbing. Or the patient can wash their hands in warm water. Next, cleanse the puncture site using alcohol, or according to your facility's established procedure. The site must be allowed to air dry in order to provide effective disinfection. Have the patient hold their hand in a downward position, allowing gravity to help increase blood supply to the hand. Twist off the contact-activated lancet's protective tab to break the seal. To perform the puncture, position the safety lancet firmly against the puncture site. Hold the lancet between your fingers. To activate, press the safety lancet firmly against the puncture site. Do not remove the device from the site until an audible click is heard. Discard the used safety lancet into an appropriate sharps disposal container. Before collecting a specimen, be sure to wipe away the first drop of blood with a clean gauze pad. Position the BD Microtainer MAP tube directly beneath the puncture site and let blood drip into the tube. After the collection is complete, wipe the site dry and apply direct pressure with a clean gauze pad until the bleeding has stopped. Cap the tube and mix the EDTA additive with the sample by gently inverting the MAP tube 8 times. Label the tube with all necessary information for proper patient identification. For fragile patients, when every drop of blood counts, choose the BD Microtainer MAP, microtube for automated process. Enabling automated processing with as little as 375 microliters of blood. For patients with low blood volumes or difficult venous access, MAP is the only microtube fully compatible with lab automation, eliminating manual steps and extra materials. And MAP uses standard sample labels, aiding in positive patient identification and a reduced probability of errors. higher efficiency, improved turnaround time, and outstanding BD accuracy. The BD Microtainer MAP microtube for automated process helps keep the focus on your patient, where it belongs.